Thanks for having me. As Jill said, I'm a dietitian with Minnesota Oncology. I manage the dietitians as well as all of the clinics around the metro area. I'm certified specialist in oncology, and what that means essentially is the dietitians who are certified specialists on oncology, have a separate education aside from being a registered dietitian, and we essentially have to do a lot more practice hours and supervised practice hours and then take a test every 5 years. So there's a lot more that goes into that kind of specialty. And just kind of a fun fact, there are only 8 dietitians in the state of Minnesota that have that specialty, and 3 of those 8 actually work within the Minnesota Oncology health centers. So we are very fortunate for that. But today I'm just going to, and I may hop around a little bit in the presentation just for sake of time, but I want to just discuss what nutrition roles, what the roles that nutrition play in, minimizing risk of recurrence and overall helping to improve your health, and maybe touch a little bit on symptom management as well, depending on where you're at in like a treatment journey. So essentially, we're going to look at, like I said, some of the diet choices and some of the misconceptions as well, actually. At the end, we can talk a little bit about, actually, do you guys see my notes, or can I delete that? Do you see that, Jill? Or is that just on mine?
I do not see your notes. I just see the slide.
Okay, thank you. So this is just a little bit of chemistry, or biology rather. In what happens in the cell, there's an initiation and promotion and progression of cell replication. I'm just going to go briefly through this just to give you an idea of what happens with cancer and how it develops. What happens initially is the initiation piece of cell mutation can occur. Maybe something within the cell is incorrect. Maybe it replicates incorrectly, and either what happens is the cell dies or it will continue to replicate. In the promotion phase, that's when some of the factors that might be already in your body can help the replication of the cell. And that could be, environmental factors such as smoking. It could be genetics, things like that, that can they act as promoters to cause the cells that are mutated to continue to replicate. And then there's progression, and that's when so many cells have replicated and mutated that it forms a tumor. Now, nutrition can play a role in that in the initiation phase, because nutrients can actually essentially cause a cell death. So it stops the cell from being able to replicate. And we'll go through today, some of the nutrition and things that you can get from your food and how that plays a role there. But also, the things that you do in lifestyle can also be helpful in minimizing the promotion and replication of cells as well. So these are some of the things that can impact cancer. So we have stress, nutrition, lifestyle, genetics, and then of course unknown reasons. So it's not just one thing that can cause cancer. And I always tell people to try not to dissect their life and trying to figure out why cancer or cancer occurs in certain people, because it could be multiple reasons. It could be genetics and unknown. It could be stress and nutrition and lifestyle. It could be all 5 things that can lead to a cancer situation. Everyone has some cells that can be mutated in their body, but all these factors tend to have to be in, all the stars must be aligned essentially to increase the probability of having cancer. Today, we're going to focus on more of the controllable stuff because there is obviously things that are not in our control. In this cell, it's kind of just another way of looking at how food and nutrition, obesity, and physical activity can impact that cell division, the promotion and initiation cell division phases that we talked about earlier. So food, you'll see here, like the food and nutrition can repair the DNA within a cell. It can prevent it from replicating. It can regulate hormones. It can improve inflammation. So it's kind of an anti-inflammatory. It can cause, like I said, it can cause apoptosis, which is essentially just medical term for causing cell death. 30 to 40% of all cancers right now are directly linked to the foods we eat, the exercise we get, and how well we're watching our weight. So the American Institute of Cancer Research has compiled a lot of the research out there on food and nutrition and lifestyle and how what we should be doing from a nutrition and lifestyle perspective to help minimize the risk of recurrence and from cancer growth. Yeah, so these are some of the nutrients that are involved with at the cellular level. And I think I mentioned that in vitro, essentially, that just means that they're finding these things within like a petri dish and doing studies that way, and found that these certain nutrients actually influence, the prevention of cancer. And I will mention, it doesn't necessarily mean that supplements are going to do the same thing. Food actually plays more of a beneficial role and influential role in minimizing cancer progression and recurrence versus taking vitamin C and taking selenium and taking curcumin. They might actually do some harm depending on medications you're taking, but also they're not found to be as bioavailable, so they don't absorb as well. And I can talk a little bit more about that in an upcoming slide. I'm just going to pass through, though, a couple of these slides so that we can get to kind of the meat and bones of this. Do I have anyone that would like to discuss nutrition before and during treatment, or do you want me to go through more of like the just survivorship after treatment kind of information? I'm just going to take that as maybe we can go through just what to do now. And if anyone has any specific questions on during or before, let me know. But well, let's just talk a little bit about like the nutrition after. So of course you want to try to manage any side effects or symptoms that might be persistent after treatment. Okay. So what you want to try to do is find or try to maintain or obtain a healthy weight closest to a normal body weight or body mass index as possible. If you have a lot of weight to lose, even a 5 to 10% amount of weight can actually improve significantly some of your risk factors. What has been found is having excess body weight or even increased body mass in your abdominal region has a little bit more of a concern associated with estrogen production. It's associated more with high inflammation. It's also associated with insulin resistance, and all of three of those things have a tendency to increase risk for recurrence. You also want to try to be as active as possible, physically active as possible. So some of the studies have found that if you can be getting at least 30 minutes a day to start, as little as 10 minutes, obviously, if you're not physically active to begin with, but you want to try to have a goal of 30 minutes per day, and then upwards of 150 minutes of moderate activity per week. They found that the physical activity that you get increases the oxygen and oxygenation of your blood, which can certainly impact, your cell's ability to replicate if they are already mutated. And physical activity also improves your insulin to be able to work better. It decreases estrogen production and improves your immunity. And then limit the energy dense foods and fluids. So if that's going to be an obvious one, the things that have little to no nutritional value and have very high calorie levels would be like soda, chips, candy, fast food, sweets, things like that are going to be more concerning because they're going to give you more calories, and certainly that can increase your weight. Beyond that, especially sugar. I mean, there's a lot of talk out there about sugar fueling cancer. but it's really more of an insulin issue than it is like a direct sugar issue. So if you have insulin resistance, just real quickly, I can explain, like, if you have any insulin sensitivity or decreased insulin sensitivity, and you eat a lot of these energy dense foods or drinks, what happens is over time your insulin is not able to take the sugar that it needs and put it in healthy cells. So what happens is your bloodstream then is going to be pretty rich in sugar and insulin with nowhere for it to go. So if you have a mutated cell, of course, that it could take that in and use that as a fuel source. So that's kind of where that concern gets into play. So try to reduce as much as possible, especially drinks. I find that people tend to get quite a bit of sugar from drinks, and that can be a huge impact if you can modify that. You want to try to follow a plant-based diet. So what a plant-based diet essentially is trying to have 5 or more fruits and vegetables per day. I try to encourage patients to use vegetables more than fruit if possible. So 3 to 4 servings of vegetables and 2 to 3 servings of fruit per day. A good rule of thumb is to fill half of your plate with low starchy vegetables, and then a quarter of your plate with fruit or starchier vegetables. So for instance, starchy vegetables would be like potatoes or squash or sweet potatoes, corn. And the unstarchy vegetables would be more of like greens, carrots, peppers, onions, anything like, broccoli, that kind of thing. And the nutrients, that if we kind of bring you back to what we said earlier, is that those nutrients in those fruits and vegetables actually can cause prevention of cancer growth. They, at the cellular level, they will help to identify mutated cells and get rid of them. And specifically, you'll see on this slide, garlic and onions and leeks, those have a biocompound that can prevent abnormal cells from growing, having tumor growth in the stomach. Garlic and fiber can protect against colorectal cancer. And like I said earlier, components within the foods actually work better themselves than taken separately within supplements. And part of the reason for that is because there are nutrients and phytochemicals in food that haven't even been identified yet. And also because certain combinations of fruits and vegetables actually have components that work together as a team to help with prevention. So this is just going to give you a little bit more information on that, at the cellular level, what some of these things do. So for example, the carotenoid family, I'm just going to go through just one or two of these. The carotenoid family has beta carotene. So think of things that are orange. Beta carotene actually is more absorbable if the food is cooked. So if you're taking sweet potatoes, carrots, squash, and roasting them or cooking them, you're going to have more available beta carotene that will absorb in your gut. Another example of a biocompound would be the sulforaphane that's found in broccoli. That is that one's actually specific to helping to prevent estrogen or hormone sensitive cancers. It's very impactful. So trying to include these foods frequently throughout the week is ideal. And then these are a couple more examples, and I can certainly share some of these slides with you. You don't have to memorize that. The other good resource to look for is on the American Institute of Cancer Research. They have a good slide and handout with all of this information on it. In addition to the plant-based diet, I include whole grains as a plant and beans and legumes as a plant. Whole grains, you want to try to find the least processed whole grains as possible. So there's breads and cereals and things like that out there. Make sure you're looking at the labels, trying to find stuff that's not enriched, refined. Those kinds of grains tend to have a lot less nutritional value. They typically have less fiber. So you want to try to use more options that have minimal processing. So if you're making your own homemade bread, great. Or if you can find, the sprouted grain breads are really good. Just kind of take a quick look at the label and make sure that there's not that word enriched or refined. You want that first ingredient to be whole wheat or whole grain, and that is a good indicator. In addition, if you don't recognize ingredients on the label, that's typically a good indicator that it's going to be highly processed. Okay, so you want a short ingredient list. Beans and legumes are also very beneficial because of the high fiber content, and they help with not only improving your bowel movements, but they increase your gut transit time. And the good thing about that is, you know, if you have regular bowel movements, it actually decreases the amount of carcinogens that kind of linger in your gut. And the beans and legumes are helpful for that, not only because of their higher fiber content, but they're also really high in protein. So it helps with minimizing fatigue. It helps with rebuilding muscle and improving your metabolism. You can also find a lot of traditionally carbohydrate-based items made with beans now. So what I mean by that is that there's a lot of like chickpea-based pizza crusts and pastas and rices and things like that. And I typically encourage using those as long as they're, again, not pretty minimally processed, which most of the time they are. Try to have some of those whole grains, beans and legumes, multiple times a week if you can. They're going to be beneficial. They make you feel full with meals as well. They give you energy, things like that. Animal foods. So you can have animal-based foods when you're on a plant-based diet. That is okay. However, red meat and pork, lamb, those red meats should be limited to less than 18 ounces per week. Red meat, pork, and lamb are considered that red meat because of their protein chain. It takes a lot longer to digest. So because of that, they can linger a little bit longer in the gut, and that can produce more carcinogen production in the intestinal tract. Sausage, bacon, and lunch meat, those things that are smoked, cured, if they have nitrates, you really want to minimize consumption of those. So those are basically kind of a limited or rare consumption. Those nitrates and nitrites have a very high correlation with specifically colorectal cancer. They can increase quite a bit of the risk associated with that. So if you have history of that, I certainly would try to minimize consumption of that. The verdict is kind of still out on nitrate-free versions of those, just because a lot of them are still pretty high in sodium. And really high sodium foods also can increase risk of GI tract cancers, specifically like the high smoked or high salted meats. Okay, so verdict is still out on that one. It's a pretty relatively new food product, having a nitrate-free food. So again, they're kind of still studying that one, so I can't with confidence say that it's safe. But it certainly would be probably a better choice than a nitrate version. Limit or omit alcohol. This also has an increases risk of specifically mouth, pharynx, larynx, like head and neck cancers, esophageal cancer, breast cancer, and colorectal cancer. The recommendation is to, if you can, have 0 alcoholic beverages, but no more than 2 per day for men and no more than 1 per day for women. The theory is that alcohol can directly damage our DNA, which can increase our risk of cancer, but also it is metabolized by the liver, and our liver is obviously something that's important in removing free radicals from your body. And free radicals are some of the things that can damage a cell. So we want to try to support our liver as much as possible, and obviously minimizing consumption of alcohol would do that. There's also some research that alcohol is particularly harmful when it's combined with smoking. As I said in the previous slide, that limiting salt is important in processed foods. Our daily intake of salt should be less than 2,400 milligrams per day. We actually need much less than this. Most often people are consuming a lot larger quantities of sodium, unfortunately, just because it's in a lot of our processed foods. But high salt and high salt preserved foods significantly increase chance of stomach cancer, and some of the it can damage some of the lining of the stomach, which is why there's such a concern associated with stomach cancer specifically with a high salt diet. So what you want to try to do is try to just look, either not add salt at the table, or try to find foods. If you want to look at the daily value, or excuse me, the food label, you want to have that daily value percentage to be less than 10% in order to be kind of considered lower in sodium. If it's higher than 10% per serving, then it's considered a high sodium food. And then also, do not use nutrition supplements for cancer prevention. We briefly touched on this earlier. High dose vitamin C, high dose vitamin E, beta carotene, turmeric, or curcumin rather. Some of those actually can impact the effectiveness of some medications, specifically chemotherapies and things like that. So you do have to be very careful in some of these supplements that are out there. I would certainly try to get them approved by your pharmacist and your oncologist before taking them. But there are some supplements that do show benefit. Specifically, vitamin D is something that I do tend to recommend, just based on the fact that if you look outside right now, it's dark. We're not really getting vitamin D. In the Midwest, we have a lot less vitamin D absorption between November and April. So it's a good idea to take vitamin D. And what I suggest doing is getting your vitamin D level checked, and then taking a supplement based on what your levels are. And the other one would be calcium. I recommend women especially taking calcium supplements, specifically if they're on breast cancer, long-term breast cancer medications. There is a concern associated with bone health. So taking calcium supplements certainly can help with increasing strength in your bones. Okay. So some of these are kind of more of like the hot topics. We kind of brushed on sugar and cancer very briefly. Alkaline diet is something that is kind of less popular now than it was at one point in time, but the alkaline diet is kind of based on like a plant-based diet, fruits and vegetables, specifically more vegetables. It essentially, the theory of it is that it changes the pH level of your blood, but it actually does not. If you're eating an alkaline or basic diet with low acid foods, you're essentially just changing the pH level of your gut, which doesn't have any correlation to what your pH level of your blood actually is. So that would not impact, cancer growth whatsoever. Obviously, eating a plant-based diet is important, so there's a lot of benefits to that, but there's really no backing on the alkaline diet specifically. Some folks ask me about juicing. I always tell people it's okay to juice as long as you're getting a good variety of fresh fruits and vegetables, cooked fruits and vegetables. As we mentioned earlier, beta carotene is more absorbable when a vegetable like carrots or a squash is cooked. There are some things though that are better to consume raw. So like broccoli and cauliflower and Brussels sprouts and cabbage. That sulforaphane that we talked about earlier it needs an enzyme to be able to, help you absorb that specific bioactive ingredient that's in those vegetables. And having those consuming those raw is actually your best bet. The second best bet would be to steam them for no more than 5 minutes. So you want to keep them al dente, and that will help to maintain that enzyme that those vegetables need to help you absorb the compound that is most beneficial to you. Boiling, microwaving typically does destroy that benefit. Another good example of just kind of good food preparation, not necessarily related to juicing, but garlic and onions actually do another, that's another example of something that needs kind of an enzymatic process. Garlic, you want to try to mince garlic or crush it, and that causes an enzymatic process to take place so that the nutrition that you would get from garlic actually is more absorbable. And so using like jarred garlic, the pre-jarred garlic doesn't have that nutrient benefit. And if you just kind of use a garlic press and put it right into your food that's being heated up right away, it won't allow that nutrient to be formed. That enzymatic process won't happen. So you actually do want to kind of either crush it, mince it, and just let it sit for about 10 minutes on your cutting board before you add it to your food. And you do want to try to not burn it. High heat obviously can destroy the nutritional value of garlic as well. It's 6:36. I do want to leave some time for questions. If you want me to go through some of the other things, I can certainly do that. But I want to make sure that I give you guys time for questions as well.
So if anybody has specific questions, you can just take yourself off mute and you'll be able to ask questions. Or if you want to type it into the chat, you can do that too.
And I can just keep talking too. So a lot of times people are interested in soy and hormone-based cancers. It is okay to consume natural-based soy. So natural soy is going to be like tofu and soy milk and edamame and soy like miso. Those are beneficial, actually. They can help minimize breast cancer recurrence because, typically in a breast cancer or some kind of hormone-sensitive cancer situation, you're producing more pretty aggressive estrogen. And natural soy produces a phytoestrogen. So it's kind of like a weak estrogen. So what that does is it actually can bind to estrogen receptor sites in your breast tissue, and it prevents or basically kind of blocks those receptor sites from being able to bind to the more aggressive estrogen that your body is producing. So it's actually very helpful to have some soy in your diet. The soy you want to avoid would be kind of processed soy. So soy protein isolate, which is in a lot of protein shakes or protein bars. It might be in a lot of the like a vegetarian frozen foods, might be in a lot of those kinds of foods that you want to try to avoid. So the natural sources are better. Organic versus conventionally grown. What I say to this is, the benefit of fruits and vegetables outweigh the risk of some of the concerns with pesticides. You can always, thoroughly wash most of your fruits and vegetables and can get rid of the majority of the pesticide residue. However, it is beneficial to, if you can and have the financial means to do so, to at least purchase some things organic if possible. Obviously, you can't scrub raspberries, blueberries, strawberries enough to get pesticide residue off. So those you may want to purchase organic versions of. Perhaps, fruits and vegetables that, you're eating the peels and things like that. So for example, apples, pears, they may have more pesticide residue absorption. And of course, you're going to be eating the whole fruit. So you may want to use organic versions of those. But you may not necessarily have to use organic avocados or bananas because you're not necessarily consuming the outside of those foods. We kind of talked about vitamin D. We talked about herbal, vitamin supplements. We talked about some of the herbal supplements. I would again kind of recommend that you talk to your oncologist. You can talk to your dietitian, your pharmacist about, just because some of those also there are some herbal supplements that actually can increase your risk of cancer. So you just want to make sure that those things, you're being smart about some of those choices. And then the ketogenic diet, real briefly, I could talk about that for a couple hours. So I'll just really briefly talk about that. It's really early studies in terms of how beneficial that is. It's very difficult diet to follow. To follow it therapeutically, you actually have to be in ketosis. So if you're following a ketogenic diet for therapeutic reasons, you would have to get your blood drawn and or urine tested to make sure that you are in a consistent state of ketosis in order for it to actually work the way it's supposed to. And it has been found to be very beneficial in certain pediatric populations. They are finding a lot of promising results in using that diet for people who have a brain tumor called glioblastoma, but not necessarily for all cancer types. And again, it is very difficult to follow because it's a fairly high fat diet, and it's not always appealing to most people, especially those who are going through treatment or who have side effects from treatment still, like with taste differences or digestive issues, that a high fat diet might actually make things worse in those situations. So kind of personalized, that might be a personalized question to ask in terms of if it's an appropriate diet to follow. Any other questions?
I just want to say thanks again, Sarah, for presenting this. I think you always give such great information of like practical things that we can actually apply, things that we can have some control over. So I think you just give some really practical applications of things that we can try in our own personal life. So I really appreciate that real life examples of things that we can do.
And you don't have to be perfect, I will say. Like, you do not have to follow one thing perfectly, okay? So 80-20 is what I tell people. 80% of the time, eat foods that nourish your body and, give you the things that you need. It's okay 20% of the time to nourish your soul a little bit. That's okay. So it's not always going to be perfect. It's actually better for you health-wise, or even like from a mental health-wise it's okay to, have, maybe a piece of chocolate here and there, or it's okay to have, a glass of wine here and there. That's fine. It's just most of the time, try to make choices that are going to be helpful for you.
That's a really good tip, 80-20 rule.
Yeah. 80-20.
Did you see that message in the chat about getting copies of the slides and any recipes that you recommend?
Sure. Yeah, what I can do is I can share my slides, as well as I have a couple of handouts with websites that have really good recipes.